The Bukavu Provincial Hospital has been receiving mass casualties and wounded patients from the intense fighting between the M23 rebels and the Congolese army. Medical facilities in North and South Kivu have reported over 3,000 injuries since the beginning of January, many of them gunshot or shrapnel wounds.
I was shot in the neck and the bullet remained inside.
We are receiving a lot of patients. As you can see, we are calling for blood donations to enable us to treat not only patients from North Kivu, but also patients from South Kivu. There are lots of patients everywhere, not only those wounded by weapons of war, but also local patients who really need our support.
Medical facilities in the region lack adequate supplies, fuel and staff to manage the growing influx of patients. As M23 rebels near South Kivu's provincial capital, the Bukavu Provincial Hospital is preparing for more casualties.
During this period of war, care is optimal as usual, but we have still made preparations so that if there is an influx of patients, our hospital will be able to take care of them.
Meanwhile, at the Bulengo camp at the edge of Goma, the provincial capital of North Kivu that M23 captured last month, residents are dismantling their shelters, where some have lived in for years. The M23 rebel group recently ordered displaced people to vacate camps in and around Goma and return to their homes.
We are now seeing, with this new situation, thousands of displaced people in and around Goma beginning to return to their communities in the territories around Goma of Masisi, Rutshuru and Nyiragongo. Our humanitarian partners are concerned with the 72-hour ultimatum given on the 9th of February by M23 representative to displaced people living in those sites and collective centers in Goma to leave and return to their villages. And in accordance with international humanitarian law, returns can only take place under safe, dignified and voluntary conditions.
Those who had already packed up boarded canoes, not certain if they had secure homes to return to.
I don't know if I'll make it. I have children, and to my surprise, we are being told to leave. I have nothing to give the children.
M23 has been accused of forced camp closures. The group has denied this, instead saying people were doing so voluntarily. The UN estimates that more than 110,000 people have left displacement sites in recent days. Caroline B., CGTN.
Well, let's now return to Chris Chamringa in Kinshasa on that humanitarian crisis in eastern DRC. Chris, is adequate support getting to civilians affected by the fighting? And what about the health facilities in eastern DRC? Are they capable of coping with increasing casualties?
Well, there's no adequate support to these people who have been displaced by the conflict because a lot of these people were getting support from humanitarian organizations. Some of them have suspended operations after the M23 rebels captured the city of Goma 2 weeks ago. And some of these people who have been forced to go back to their villages are people who are elderly, people who are injured. They cannot walk that long distance. Some of them have very little children. They have nothing, no money on them, only the clothes on their back. And they have been complaining about this very difficult situation that they have been put in by the M23 rebels. It's a very tough situation. They're in dire need of food, water, medicine, and other basic necessities. We've also seen that, heard from international organizations that hospitals in Goma are still overwhelmed by the number of injured people. The UN has been calling on the M23 rebels to open the airport, which is the access area for food and other humanitarian supplies, but that has not happened. And so it's still a very tough situation for the people who have been caught up in this situation in eastern DRC.